know that there are great disparities and inequities in our healthcare system. Free clinics have worked very hard to address those issues. The COVID crisis has really highlighted the disparities in access to care and the consequences of not having access to care in the Hispanic and the African American communities. And not just having access to a doctor, but what all leads up to that. Your condition coming into a pandemic like this is so important. So that is one thing we've really focused on.
Free clinics help address the disparities in health that we're experiencing across the country. Right now, we're in a double pandemic, and we're seeing how Black and brown communities are being disproportionately impacted by COVID-19. Before this, we knew that there were inequalities in healthcare, and we also knew that your zip code matters more than your genetic code. And so what that means is that you can have access to certain services that others may not have access to, and you are able to have a longer lifespan. And so that includes access to quality health care, access to a quality education, access to safe places to exercise, and fresh fruits and vegetables. I think that the free clinics get that, and they provide wraparound services to address those social determinants of health. When full-service grocers decide where they want to set up shop, it's based on the demographics, and they are not usually going to open a store in a marginalized community. And so we have food deserts in areas where they're already experiencing other actions of discrimination. And so it just adds to mortality and morbidity rates in those underserved communities. Not just access to food, access to adequate housing. Not having a stable home is something that some people take for granted. The poverty rate, just here in the capital area, above 20% in Richmond City. And so when you think about being able to afford health care, some people are just trying to figure out where they're going to get their next meal.